Everyone, in this video we'll talk about hematology. Hematology deals with all blood related products. When you draw a blood from patient, the whole blood after centrifugation, you will get three layers. The bottommost layer is the red blood cell, whereas the topmost layer consists of plasma, and the central layer consists of white blood cells. So the total blood, 55% of the blood volume comprises of plasma. The remaining 45% comprises of all the cells, including white blood cells, platelets, and WBCs. Of the plasma, 90% contains water. The remaining 10% contains proteins, electrolytes, and other hormones and waste products. In the formed elements, around 98 to 99% of the cells are RBCs. The remaining 1 to 2% of the cell contains all the platelets and white blood cells. Now this is an important terminology which is called as plasmapheresis. This is important from MCQ point of view. So plasmapheresis is nothing but removal of plasma from a patient. So how do you separate plasma alone from a patient? This is used for plasma therapy in case of a patient who is having any deficiency in the plasma, or if they are having any excess of antibodies because of some diseases, any allergic reactions. If they are having excess antibodies, the patient whole blood is removed and the plasma alone is separated, and a replacement fluid is given which might contain a fresh albumin, fresh frozen plasma, and the waste plasma is removed and the cells are again transfused back to the patient. So this terminology is called as plasmapheresis. Next one is hematopoiesis. This is again important from MCQ point of view. So the formation of a blood cell, 0 to 2 months it takes place in the yolk sac. After that 2 to 7 months it takes place in liver and spleen. Then at the 5th to 9th month it takes place in bone marrow. Then slowly for infants it is bone marrow and almost all the bones. And when you come to adults, it is only the long bones, vertebrae, ribs, sternum, sacrum, and pelvis. So hematopoietic stem cell, we call it as hemocytoblast. So that you can divide them into, after the stem cell, it divides into myeloid progenitor and lymphoid progenitor. The myeloblast, they give rise to a megakaryocyte which leads to platelets, erythrocyte. A normoblast leads to erythrocyte, red blood cell. Then it also produces something called as mast cell. Then we have the myeloblast which gives rise to all the white blood cells. Whereas the lymphoid progenitor, it gives rise to lymphocyte. Now these bone marrow, apart from the blood cell, it also produces other cells like osteoclast, Kupffer cell, mast cell, dendritic cell, and Langerhans cell. So now let's see what are the other cells. First one is Kupffer cell. Kupffer cell, it is also known as stellate macrophages. They are nothing but specialized cells localized in the liver. So when macrophages are nothing but a monocyte, when it enters a tissue, it is called as macrophage. And these macrophages, they have different names when they are localized in different organ. So under the liver, they are called as Kupffer cell. Next one is mast cell. Mast cell are nothing but a granulocyte which is almost similar to a basophil, but they have a different cell lineage. Apart from that, the difference between a mast cell and a basophil is mast cells, they have a round nucleus, whereas basophil has a lobated nucleus. But both are granulated cell. They contain histamine and heparin. The important point related to mast cell is they are something related to allergy. So allergies are mediated through immunoglobulin IgE, which triggers the mast cell degranulation that leads to inflammation. Next one is dendritic cell. So dendritic cell, like Kupffer cell, these are specialized cells which are found almost in the external environment like the skin, nose, lungs, stomach, and intestine. So they can also be found in immature state in the blood. Though they have, because they have similar appearance to the dendrites of neuron, they are called as dendritic cells. Now, a specialized form of dendritic cell in the skin, they are called as Langerhans cell. This you should not get confused with something called as Langerhans cell. So Langerhans cell is different, Langerhans cell is different. Langerhans cell is a giant cell. These are found in granulomatous condition. Whereas Langerhans cell is a mononuclear epidermal dendritic cell which we saw, which is a specialized form of dendritic cells seen in the skin. So that is the main difference between Langerhans cell and Langerhans cell. So this is a very important MCQ point of view. So you should not get confused between Langerhans and Langerhans cell. The next one is hematocrit or packed cell volume. So this is nothing but once you centrifuge the blood, you will get different ingredients of blood, that is plasma and red blood cell, white blood cell. Depending upon what purpose you are doing, you can extract the particular element of the blood component. So uses you can use for detection of presence or absence of anemia or polycythemia. So in case of normal, you will have the normal composition. In case of polycythemia, you will have more amount of red blood cell. In case of anemia, you will have less amount of red blood cell. So accordingly, you have two parameters mainly, MCV and MCHC. MCV is mean corpuscular volume and MCHC is mean corpuscular hemoglobin concentration. So, when there is increased MCV and normal MCHC, it is usually due to vitamin B12 deficiency. The type of anemia is called as macrocytic normochromic anemia. Next one, when you have low MCHC and low MCV, it can be usually because of thalassemia or iron deficiency anemia, and the type is microcytic hypochromic anemia. This one is very, very important. Then the last type is normocytic normochromic anemia, which means cytic means the cell size, chromic means the cell color. So the cell has a normal color, the cell has a normal size. So you will have normal MCHC and normal MCV. This might be because of anemia due to chronic disease or because of chronic blood loss. So to sum up, iron deficiency, you will have total iron binding capacity very, very high, whereas the mean corpuscular volume and mean corpuscular hemoglobin will be low and the RBC size will be microcytic. Whereas in B12 deficiency anemia, which is a pernicious anemia, you will have macrocytic size and increased MCV, increased MCH, whereas total iron binding capacity will be normal. Hemoglobin, it is found in RBC and the main function is to transport oxygen. So hemoglobin mainly consists of heme and globin. Globin has 4 globin chains, 2 alpha and 2 beta. Heme contains porphyrin ring with a central ion. So there are 4 heme groups attached to one globin chain. So one hemoglobin molecule can carry up to 4 oxygen molecules, and this is called as oxyhemoglobin. In case of a ferric state, see, it has to carry iron in ferrous state. In case of ferric state, it forms methemoglobin, which is an MCQ. Hemoglobin disorder, you don't need to learn anything much about this. All you should know is about sickle cell anemia and thalassemia. Just remember, quantitative disorder, it is thalassemia. Qualitative, it is sickle cell. This is a very important MCQ slide. So for sickle cell anemia, what you should know is, in case of a normal blood, the sequence for amino acid, if you see the 6th position, you have glutamic acid. Whereas in case of sickle cell anemia, in the 6th position, instead of glutamic acid, valine is getting replaced to glutamic acid. So because of that, you will not have a biconcave shape, rather you will have a sickling cell. So because of this reason, red blood cells sickle and they get stuck in small blood vessel. So that's why it's called as qualitative disorder. So RBC, when it gets destructed in spleen. It gets split into 3 molecules: iron, globin and porphyrin. Erythropoietin, it is a important hormone which stimulates the production of pro-erythroblasts from hematopoietic stem cells. And in MCQ from erythropoietin is 90% of the erythropoietin is formed in kidneys, where the remainder is formed in the liver. The next part of our video we'll see in hematology part 2. Thank you.